In the vibrant corridors of Uganda's universities, a silent crisis brews, one that threatens the academic dreams and well-being of countless students. Recent studies reveal a troubling rise in substance use among university students, with alcohol, marijuana, and prescription pills. At Makerere University, for example, about 4 out of every 10 students have used alcohol, and over 1 in 10 have tried other substances like tobacco, cannabis, or energy-boosting drugs. In recent years, Makerere University, one of Africa's most prestigious universities or higher institutions of learning, has encountered very many issues surrounding substance abuse among its students. Miss Liz Atim, a clinical psychologist working at Makerere University's University Hospital, shared various information surrounding the topic of substance abuse.
Yeah, so some of the issues that students usually experience could be physical, but also could be issues that affect their mental health. And some of the common physical issues that we have noticed here at Makerere University Hospital are most people have developed liver issues, liver diseases, and liver conditions, mental health illnesses, or threats related to substance abuse is infections like HIV and other STDs, because most people, when they are intoxicated, they involve themselves in reckless behaviors. So we have seen some students coming in here and they didn't really have this HIV, they didn't really have these STDs when they came to campus, and now because of the substance abuse and involving in reckless behavior.
Daniel Mutumba, a second-year law student at Makerere University, shared thoughts on the types of substances that are commonly used among the youth and why they're used.
When you're in an academic setup, there is a lot of factors that can influence someone to use drugs. You have to consider the pressure that comes with education. I mean, look at the setup of MOOC. We have things like coursework, week. It all goes down to the student themselves actually, because if you're not ready, you are going to create unnecessary pressure, and you will need these substances to give you that much needed confidence. So the biggest contributory factor to substance use in the university is basically the pressure that comes with the academics, and we all come from different backgrounds, so you can't really ascertain how different people in one's background will take their academic failures. I mean, people.
According to Dr. Paul Nyende, a senior lecturer at the Department of Mental Health and Community Psychology, substance use affects students' academic participation and their performance in classroom activities.
Definitely, drug use often causes what we call a motivational syndrome. Usually, a person who is dependent on a drug loses the drive to achieve, and therefore, over time, there is slowing down in terms of academic involvement and withdrawal, reduced attendance in class, and ultimately poorer performance because of not being able to catch up with assignments and classwork. So it's a known problem that leads to poor performance of students. Many students are aware of the challenges and consequences related to drug use. More especially, of course, alcohol, which is widely accepted, but other drugs are also used, like marijuana, which are easily accessible.
Professor Paul Nyende as well shared some of the programs and initiatives within the curriculum and within Makerere University that address the issue of substance use.
Yes, I think we are open to providing therapy for people with substance-related disorders. We are open to counseling and support. We also have a directorate of counseling at the university, and we do refer students with challenges that are beyond to the directorate of counseling for further management. I think we need to have programs that reach out to students. The university needs to be more proactive in terms of not laying back and waiting for a knock at the door that somebody has a problem, but carrying out regular drug prevention programs, or let's say talks. The Directorate of Counseling should be seen to reach out to do general talks for exposure to students and also to give them information regarding their availability.
Despite the many initiatives being conducted by the university about the cause, would the students still feel comfortable to share their inner struggles with the university health services? Idris Osongo, a medicine student, shares his view.
Several occasions I've tried to reach out for medication from the university hospital, and I think the staff is really professional enough